Alrighty, so as we kick off this presentation, I would like everybody to join me in a quick activity by closing their eyes. Imagine you're in a meeting room with about 20 other individuals. Now, keeping your eyes closed, go back in time about 2 years to the COVID-19 pandemic. Did anything change? Feel free to open your eyes now. Your depiction of the meeting room may have changed in certain factors, such as by adding masks, social distancing, or even having individuals join in virtually. Essentially, Children's Mercy has faced many problems like this post-pandemic with their patients and families at the waiting room. NRC surveys have partnered with Children's Mercy Hospital to give a better understanding of what problems are being faced at the hospital. Essentially, the pandemic has taken out all activities such as books, games, etc. You can name it all, magazines for both families and patients at the hospital, leading to parents getting very frustrated and bored with the long hours of wait at the waiting room. So the solution essentially that had to be done through empathy work came out to be very simple and feasible in the sense that patients are not always going to be engaging in activities, so a small, short gist of adrenaline could be the better answer. So essentially the solution I chose was implementing whiteboards. Now here's the thing. Whiteboards oftentimes have metal bars that can hit patients, and especially at Children's Mercy, children with shorter heights can hit those bars. So instead of implementing a full-on whiteboard, pasting a whiteboard roll onto a wall would be more feasible. On top of that, it'd be more feasible to prevent infection diseases because COVID-19 has taught us that all these activities are taken away because we don't want infection and bacteria to be spreading again. So instead of using erasers that can, be spread through patients, we can use Kleenexes and tissues instead to wipe down the marks. So essentially, as a patient checks in, they will receive a Ziploc bag with dry erase marker, Kleenex tissues, and a note on the sign that says, "Please return at the end." So as they're sitting and waiting, they can engage with their families. So what is the approximate solution timeline for this to all occur and take place? So the first week we will need to order supplies, take down mounted items like bookshelves. So we'll need to take dry decks, scrapers, and everything to flatten out the wall before we apply the whiteboard rule. Then the second week we'll need to, I already covered second week, I'm so sorry. So yes, after you order that second week, we'll remove and apply the whiteboard. The third week, we'll have to bag the markers and the tissues in the Ziploc baggie. And then by the next third day, we can start taking action. So the approximate budget really is quite simple, but the biggest factor is the whiteboard roll. That's about $61. So as you can see, we're gonna use dry decks, putty knife, all the small things for prepping, and then afterwards you'll have sanitation wipes and a return basket to ensure that infection does not spread throughout the time. So the total cost will end up at $165.30. So here's my ask of you guys, is that this project is quite simple and quite straightforward, and essentially we really do need donations because dry decks and small things like a putty knife can be found in a day-to-day, household. So we need donations and essentially a team to volunteer and help put this together, help put the whiteboard roll on the wall and essentially help bag those items. Something that's not on the slides, but I would also like to ask for is that going forward, if this project or if this idea continues to remain within the hospital, we could invest in a UV light sanitizer where instead of having to buy bulks of Clorox wipes or any Lysol wipes, you could just instead put them in that cubicle of the UV light sanitizer. So that's it for me. Thank you so much.